Welcome, everybody. Thank you very much for joining us. Today, we are launching a new series for Plug and Play, the InsurTech program. We're launching a new webinar series. So it means a lot for those who came on and joined us for our first session. This is a new strategy that we're trying. Obviously, these are very trying times with coronavirus and everything else that's going on. And in part of our response, Plug and Play has decided that the InsurTech team is going to release a weekly webinar series. Now, this is definitely still an experiment. We'd love to hear from our audience and particularly our partners, what's top of mind for them, what types of formats and information can we, use this platform to convey. But more importantly, want to make sure that, we're having a regular cadence, we're checking in, and we're showing our partners and our ecosystem the technologies and the startup companies that are really important right now. That being said, we have a lot of companies that, you might be familiar with. The one thing that's really important to understand about Plug and Play and technology, a lot of these ideas and a lot of these solutions have been around before. We're here to kind of relook at some of the things that we've seen in the past, say, why are these solutions so important and relevant today? Timing is extremely important in technology and applications. And right now, the timing for a lot of the tools that we've been exploring over the last couple of years have been very, very much prioritized. Additionally, there's a lot of cross-industry exposure right now. Coronavirus affects every part of the globe. It affects every single industry. And right now, Plug and Play across all 16 verticals are responding uniquely to the coronavirus situation. The insurance program obviously has a huge implication here. And we're going to be looking deeper into our adjacent industries to start servicing the technologies that are relevant for the insurance industry to respond. This also means that the insurance industry needs to start looking at additional industries and ideas to figure out how we can collaborate in a unified response to this global changing dynamic. Times of struggle or change are oftentimes an innovator's dilemma and delight. The reality here is this is a absolute conduit of change moment, and technology and new ideas and new applications of those technologies are going to find real traction and scale in the next couple of years. It's trying times, but it's also very fertile ground for opportunity. And this is when we can actually implement change that has real meaningful impact at scale and lasting impact. So again, we thank everybody for coming in. The attendee numbers are kind of rising here at this point, so it looks like we can kind of get things a little bit started. As a reminder for those who didn't chime in initially, we are launching our weekly webinar series here. One thing to really keep in mind is that we're not trying to solve all the problems with this webinar. We are trying to create a foundation for our partners to engage. Down the line, you'll start seeing different renditions of this format. Additionally, private engagements. And what I mean by that is you will see this webinar coming out every Thursday from 10 o'clock to 11 o'clock. But oftentimes you'll see other private speaker series, roundtable discussions, things that are exclusive for our partners or exclusive for our startup alumni that will be blocked on either before or after this webinar series. So stay tuned. There will be lots of things being announced. I know this is kind of a crazy time with lots of new announcements coming out from Plug and Play. We'll be using this webinar series as an opportunity to make the communication a little bit more consistent and to give you guys a more consistent time to engage and chime in on and hear what's happening in the insurance world. Very quickly, a couple of housekeeping items. Plug and Play, we still have a full team and everybody is still working around the clock. We have a couple of people on our side right now are help managing this webinar, and they are sharing some slides with us as well right now. A couple things we want to touch on. Today we are focusing on beyond wearables and non-invasive diagnostics and underwriting. Next Thursday we'll be doing things like unprecedented disruption, managing business interruption and pandemic. The following week we'll be doing things like digital health, digital distribution and life and health. With the following after that doing digital distribution and property and casualty. So these themes will change, and we would love to hear from the audience what topics are top of mind because we can adapt these. But the point is, every week you can chime in and hear what are the biggest and most important trends that are happening in our industry. It'll just be a taste, and you can always follow up with your plug and play team to get more information, to follow up with these startup companies, to build lists, or to start deal flows that can expand deeper into these subjects. All right. Well, with that, I'd love to get started with our fireside chat. We have an incredible speaker here joining us today. Victoria, are you on the line?
Yes, good morning. Hi.
Morning. Thank you so much.
Yeah, thanks for having me.
Awesome. Well, it's a real pleasure to speak with you today. It's been lovely getting to know you over the last couple of days and hearing all the fascinating perspectives that your role entails. Maybe to start us off, could you share a little bit about yourself and the role you have at the UC California system?
Sure. Thanks, and good morning. Nice to meet all of you virtually. As Hutch mentioned, I'm Victoria Slivkoff. I head innovation and entrepreneurship for the University of California system. And UC, as I'm sure you know, many of our campuses, but not necessarily know what the Office of President does. So UC is the largest public research university in the country, and which encompasses 10 campuses, 5 medical centers, 3 national laboratories, and a statewide agriculture and natural resources group. And we serve 280,000 students. We have 200,000 faculty and staff. And what's really unique about us is that we have this massive asset of 2 million alumni that spread across globally. We have the largest IP portfolio of any university in the country. UC Research generates 5 inventions per day. The last fiscal year, our royalty income reached 200 million. And last year alone, companies created from our technology license from UC generated over 21 billion in revenue and raised a combined 6.6 billion in investment. To touch on the research front a little bit, we are the nation's largest academic recipient of federal funding for all research and other university-based projects. And we're conducting approximately 1/10 of all the academic research and development in the US. So, our ecosystem is truly, truly vast. On the innovation and entrepreneurship front, my office supports an ecosystem of 60 startup incubators, accelerators, dozens of entrepreneurial programs, competitions, boot camps. 4 California Institutes for Science Technology was established by Governor Gray Davis years ago. And that is a partnership between the industry, the state of California, and UC, serving as a launch pad for new ideas and companies. And our ecosystem extends to serving off-campus network of startups founded by UC alumni. The unit I operate from, UC Office of President, is the central hub for managing UC's business operations and finances. The Office of the President oversees our system's annual 37 billion in operating budget, as well as 126 billion in investment for various funds, including endowment and pension. So I really think that UC is a powerhouse for innovation and entrepreneurship. And we're just, we're really just starting to scratch the surface of the innovative technologies and entrepreneurial endeavors within the system. And I particularly enjoy working with researchers and entrepreneurs to connect them to resources and networks to help them put their great ideas and discoveries in the marketplace. So in my role, I focus on developing strategies, resources, infrastructures, partnerships, and policies to support the campuses. Taking what we do on campus and working with industry partners, such as all of you on the phone, to disseminate our innovation to the marketplace so that we can reach the maximum number of people possible. And this is really truly aligned with our mission of, teaching, research, and public service. We see companies wanting to tap into resources that are only a university can offer, which include our, startups, IP, research, faculty, domain experts, and that's really our secret sauce. Is the access to faculty, alumni, talented students that serve as a potential talent pool, and then access to fresh new ideas. And I really see our role as in helping corporate companies get out of their bubbles and give them a broader context to help them to be more innovative.
Incredible. So that's, wow, quite a bit that you're overseeing there. I can only imagine. It's not unlike, what's being faced by a lot of the corporate innovation teams right now. I mean, a lot of these organizations have 50, 60,000 employees out globally. They're working on business units and products all over the globe and in different types of use cases. It's a lot to manage, especially when it comes to all the external parties that they're working with. Mm-hmm. Especially when it comes to change, right? So innovation is always kind of at the forefront of change. It's also a bit of it's always at odds with the structure that it's disrupting. And traditionally, a lot of the corporations that really rely on this type of structure have a difficult time responding quickly and innovatively in a time of significant change like we're experiencing right now. So in that kind of situation, how is the UC system kind of responding to all these new challenges that are being faced? And what are some of the unexpected solutions that you see are alleviating some of these pressures?
Yeah, so I mean, as you can see, the UC system is vast, and one of the central roles we serve at the Office of the President is to coordinate across the system. And what I'm doing is introducing more connectivity, allowing each campus to express what they do best, and ensuring that there's a higher sense of collaboration across the innovation officers on the campuses, so that you'll see more partnerships across the campuses. Our job here is to fill the gaps and bring more resources to the campus and the system as a whole. And as an example, I coordinate a monthly call, biannual in-person staff conference so that we can, share best practices and opportunities. And especially in times like this, when we're looking to address, this massive pandemic, our role to coordinate has never been so important. By staying close to our constituents on the campuses, my office can build programs and relationships and resources that can truly service the campus needs. The campuses are doing amazing things, and I'm learning new things every day. And this is one of the best parts of being in this job, is sitting at the forefront of all this groundbreaking innovations and research coming out of the system. What my office does is a layer add, is increasing the pie of opportunities so that we can support more multi-campus collaborations with industry, and then increase collaboration with our campuses. From an external partner's point of view, it is helpful to have a hub to help coordinate across the systems, particularly if there's an interest to work with several of our campuses. So we really serve as the conduit of that function. I work with an amazing group of people. They're just so dedicated to the mission, and honestly, truly takes a village to do what we do.
I think there's quite a few people on this webinar that can attest to that. And so in that situation, right? So what has been some of the top things to mind, especially from the population health perspective, the health services perspective? Not only are the hospital systems being overrun, but you have students that are being sent back home. You have education that's being adapted. What are some of the solutions you're seeing that have been able to bubble up quickly in the ecosystem as a response to the framework you guys have set up?
I'll take you through how UC's been responding to COVID-19, then take you through some of the examples of how we've been, leveraging our technology to address this problem. So first, as soon as the pandemic broke out, our priority is to ensure that, the health, safety, and well-being of our university communities, and also our broader community. And our leadership has been monitoring this situation closely, and that we're doing everything we can to protect our students, faculty, staff, medical patients, and campus visitors. As many of you know, universities do not move fast, but our community has been amazing and coming together really quickly to provide resources and support to our staff, researchers, and entrepreneurs, so that they can do what they do best to fight this pandemic. And as many of you have done as well, we quickly stood up a website about UC's system-wide response to COVID-19 and other helpful resources. Particularly, this is a very trying time for our startups, as many of them are trying to tap into stimulus funds and partnerships and resources so that they can continue building their companies. And so one of the first steps we did was to assess our capabilities to address this pandemic. We sent out a rapid response survey to UC researchers, and that resulted in gathering more than 300 research initiatives designed to combat this virus, and a number of startups working on a solution. And that list continues to grow. So now we have the system-wide inventory of folks that are working on solutions to address this. And many of them have quickly also pivoted their work to address this problem. Our medical centers are pursuing clinical trials on potential drugs that may be effective for COVID-19, and we're leveraging technologies like AR, VR to help us study, different dimensions of the virus as it evolves, as it mutates. So we're really, bringing together the best of our, our medical expertise and technologies and people to bring to make that happen. Couple of things to highlight, that there's a new public-private consortium that includes UC San Diego and Lawrence Livermore and Los Alamos National Labs in using supercomputers to answer questions about the virus in hours or days instead of weeks and months. So really, expediting how we're leveraging data and infrastructure to come up with solutions. And earlier this week, our UC Health will begin sharing daily updates via its UFCA Health Twitter account about COVID-19 testing volume, number of positive tests, and the age distribution of those infected. And that's gathered from our 5 medical centers across the state. So as I mentioned, this is a really valuable resource for us because we do have visibility because our medical centers are spread across the state. And this dashboard is going to help us and state and federal agencies to understand the rate of increase in cases and how this spreads demographically in near real time in order to make the most effective decisions and planning. And this is enabled by drawing on our data science experts across the system. We were able to quickly build and launch this reporting tool. And again, I think UC is uniquely positioned to give public health officials the visibility that they need to respond to this pandemic. And something just got launched this morning, the UCSF Health Hub launched a volunteer patriots program to match industry experts, advisors, and investors to companies actively developing solutions to COVID-19. So we know that, and ultimately we know that research is key to solving this crisis. So we're actively working with federal agencies, state lawmakers, and industry partners in responding to this pandemic. 2 days ago, we launched a grant program to help jumpstart high impact research projects, $2 million rolling admissions until the funds are completely depleted. And our goal is to help researchers begin work as soon as possible, knowing that the larger federal money may take longer to be distributed. So we've really been facilitating greater collaboration between researchers and startups developing solutions in this area.
Fascinating. And so has that been really the key to getting technology to market fast? So as you're looking at this, you have this incredible opportunity to gather data from the health systems and everything like that. You also have this ability to extend beyond the health systems, right? Into the homes of people, into the lives of students and so many others. How are you guys approaching this from kind of the extended standpoint? How are you guys, ensuring that the data is coming in, not just from the hospitals and everything else? Are there particular technologies or tools you guys are using? Or
Great question. So I got 2 examples from our what UC is doing, one from our alumni company. So a group of UCSF physician scientists launched a COVID-19 citizen science, which is an app that allows anybody in the world to download, and so they can upload information through the app, and that data is used to help researchers track how the virus is spreading, and then help to identify ways to predict and reduce the number of new infections. The participants are also given the option of providing near continuous geolocation data. And soon, this is tying to the wearables conversation, that additional data from Fitbit or other, biomonitoring devices, including, blood pressure, weight, blood oxygen levels, temperature, and exercise and sleep can be collected. In the long term, we're really looking at this study to help us identify behaviors, influences, and factors that increase or decrease the risk of infection or that affect outcome after infection. Now, while cell phones are essentially ubiquitous, this is still the early days for mobile health studies for us. But this effort has the potential to be the largest ever prospective, epidemiological study of infection diseases, and perhaps we can use that for the study of any diseases. The information is collected in real time, so instead of relying solely on memory or past events, we can, leverage wearables technologies to more accurately identify associations between variables and risk. So that's one example taking place at UCSF. A second one I want to highlight is at UC San Diego. Data scientists are working with physicians around the country to create an early alert system for COVID-19 by using a wearable device to monitor more than 12,000 people, including thousands of healthcare workers. So this is, sort of addressing your point as how we're working with different constituents, right? How is this penetrating into the medical community, schools, the general population, and working with corporate partners. This is already underway at hospitals in the Bay Area and at the University of West Virginia. And based on the early data analysis, we're able to predict when someone's getting sick, whether it's going to be a mild, severe, and potentially whether the illness is specifically to COVID-19 or perhaps it's the flu. And we're pushing to get this to as many people as possible. So this is really crowdfunding that information. Participants are also can have the option of providing samples, which includes swabs, stool and blood tests that will confirm infections and immunity. So it's creating the feedback loops that we can use, real-time data and also real sample collection to validate what we're tracking and our sort of our analysis. And our researchers are mindful of privacy concerns. So while people opt into the study, they made their data available for 3 months at UCSF, and then it's anonymized before a larger scale analysis takes place. So we really take privacy issues very, very seriously. And the ultimate goal is to use that data to predict the virus spread and then set up an early alert system. And the
That's
last,
awesome. Oops, sorry.
Yeah. And the last example I want to mention is from our alumni community startup. I want to talk about a company, BioTrillion, that it was recently featured as a finalist of our system-wide annual pitch competition. Is a company that's developing a mobile digital biomarker platform called BioEngine 4D for detecting early diseases, and they're leveraging machine learning and AI to disease development and to help figure out how we can be more thoughtful about coming up with therapeutic solutions. So, digitally measuring signs in the eyes and face, and this is using a mobile phone, which is easily accessible and owned by, billions and billions of people. And in terms of the bio targets, it's now looking at neurology, digitally detecting drugs and dementia, and then long term is looking at diseases beyond neuroscience and other physiological systems. And the company quickly pivoted to come up with solutions to address COVID-19. Is that now a quarter of the team time and skills in technology and physiology is pivoting to identify biomarkers to mitigate and identify COVID-19 issues. And then they're extending this solution based on their current core offerings in digital biomarker technologies. And what's really, really exciting is that they're having conversations with 4 senators and also the White House COVID task force in terms of how do we quickly deploy that in market. So think about if we can have it set up at the border so we can detect early signs of COVID-19 as we're screening people to come in and out.
Awesome. That was fascinating, and definitely another startup company for the list for us to follow up on. That was an incredible. I have so many notes here and the questions I want to follow up and ask you, but unfortunately we're a little bit out of time. So for everybody on the line here and such, how can people follow up with you? What are ways that you're looking to call on help? What's next steps in terms of getting involved with the UC system?
Yeah, so a plug is it would be fantastic to partner with more corporate partners. And specific to COVID-19, we now have a system-wide inventory of research and startups working on the solution. As I know that Plug and Play has a COVID-19 incubator special task force to help accelerate that solution. So I'm putting together a platform to match industry experts, advisors, investors, and philanthropists, looking to help companies building solutions to COVID-19. So I'd love to talk with anybody who's interested in working with us.
Wonderful, wonderful. Well, I applaud all the good work that you were doing, and thank you for joining us today, and very much looking forward to following up personally, and I'm sure we'll have some more time to engage with the audience here in the near future as well.
Yeah, thanks for the time. I appreciate the invite. And anybody can reach out to me through my email, which Hutch you'll distribute, right?
Absolutely, yeah. You guys will see a follow-up email, on how to contact.
Okay, thanks. Have a great day.
Thank you so much. All right. Well, that was a fascinating conversation. I know I have a lot of follow-up questions. I hope you guys do too. It really does speak to just the significance of that ecosystem, how they're putting the parts together, how they can really take ideas to market really quickly here. And there's a lot of learnings here, both from how we can adopt some of these principles internally in our own organizations, but also how we can collaborate externally as well. So, and moving on, we have a number of startup companies today. We have 5, in fact, that will be doing quick presentations. This will be a format that we are looking to run more regularly in the future. So you can always expect to hear a bit of thought leadership, as well as some examples on how you can actually start enacting some of these technologies. You will see a broad spectrum of different types of use cases and solutions. It's important to kind of think open-minded. How can we think new ways of using this data? If we saw this company before, what's going, how are they pivoting? What's a unique opportunity, or what's a new angle that we can be leveraging this technology today that may have been different than it was, even 6 months ago. So with that, I'm going to turn it over to our Rockstar Program Manager, Rachel, who's going to facilitate the next startup portion of the day.
Thanks so much, Hutch. Good morning, everybody. Thanks for joining us. As Hutch mentioned, we're really excited to show you guys these 5 startup presentations that we have lined up. Some of these guys are veterans in our ecosystem and have some new interesting use cases in the current climate. And some of these are brand new startups to us. Before we kick it off, just a few general reminders to remain muted if you are not presenting, and to use the Q&A feature. So our startups are going to have 2 to 3 minutes at the end of their presentations for questions and answers. Be sure you're using the Q&A button at the bottom of your screen, not the chat feature. When you see my screen pop up again, it means time is winding down on the presentation, and we'll pop into questions from there. Any questions that are not answered, we're happy to follow up. You'll also be asked at the end of the session if you'd like to connect with that startup. Please let us know if you want some one-on-one time with that startup. We are also happy to connect you as well. So with that, I think we can move on to our first startup. We have Cherry Home. So Nick, if you are online, I believe you are.
I am. Hi.
Welcome.
Thank you so much for having me. So I'm sharing my screen right now. Quick second. So today I wanted to talk to you about AI. I'm pretty sure you're already sick and tired of all the AI talks and how AI is going to change our society, the world we live in, everything about self-driving cars and trucks and self-flying cars. Well, I've been looking outside this morning. There's pretty much nothing flying in the air. So it's all in a very distant but bright, I'm sure, future. I want to talk about something which we need right now during the COVID times. How do we make AI help us take care of our loved ones, of our aging relatives, which live alone, without having to interfere with them personally, without having to visit them and expose them? So in order to understand that, first we need to figure out how machines can see the world and how they perceive what they see. So let's start with something simple. This is a spreadsheet, which I populated with numbers from 0 to 255 and applied conditional formatting. I'm pretty sure all of you are very good with Excel. You know how it's done. Basically, the higher the number, the brighter the color. And it doesn't make much sense yet, but if we zoom out, and if we zoom some more and some more, then we'll be able to see that there's a certain shape in there. And if we continue zooming out, we see that it's a face of a man, and you can even recognize a gesture. So what's happening now is that your natural neural networks are picking up all of the shapes, patterns, and textures, forming this picture, and you understand what's in there. The problem for the machine is that for the machine, it's still a spreadsheet. It's an Excel spreadsheet. So in order to have a machine some sort of understanding of what's in the picture from that spreadsheet, some time ago, people have figured out a way to put this into some math formulas, which are not even that hard. There's just a massive number of simultaneous calculations. And to spit it out a result. So if we put in like an image of a cat, it's going to tell us that it's a cat. One big problem with modern times machine learning used for computer vision is that all of these algorithms care about textures way more than they care about actual shapes. And this is one of the reasons the object recognition is not very good. And another reason is that AI is just not able to understand what is happening in the scene. Like if it's a video of a person walking around, it's super hard for AI based on just textures and changing these textures to figure out what's happening. Because for us humans, it's structural data, right? Humans have arms and legs, and we walk by moving arms and sometimes legs too. And for a machine, it's just textures moving. And another problem is that because of this approach, this is a cat, and this is also a cat. Because for some unknown reason, this texture resembles the texture of a cat. But this is not a cat. You see, it says it's illustration, design, a desktop, no person, vector, some sort of a drawing of a cat. Us humans clearly see that it's a drawing of a cat, and it's a pretty good one. And actually, for us humans, it's even easier to comprehend information if it's simplified as a drawing. This is why we use this approach in critical conditions, like when we're driving and we have to understand the core concept of what's trying to be transmitted. We use drawings. This is why kids love simple cartoons, because it's super easy for them to figure out what's happening without all of the additional unnecessary context. Like every particular stem of grass in this field would be unnecessary context, like cloud textures in the sky would be unnecessary context. So kids do not care about that. They only happen about what's happening with Peppa the Pig and their family. So what if we apply the same approach and simplify pictures for computer? Instead of making them see humans, we'll make them see stick figures. And we've actually applied this, and this is a technology which we call cherry pose. It finds all of the human body parts in the picture and draws a stick figure out of them. And it's like a kid's drawing, and super easy to comprehend, and we make other neural networks watch it and understand what's happening. Like here it understands that there's a human and it's walking. And if we're good enough, we can even tell that it's the human's walking towards the bathroom. But we have a problem here. You see, the human has disappeared, and the AI says no people detected. So in order for AI to realize what's just happened there, we needed to possess some certain type of logic. And since human logic is something we cannot possibly understand or yet explain to a machine, we would be applying some easier type of logic, dog logic. So when puppies just come into our families, they don't even know what's happening around them. They don't understand how human society functions or how this particular household works, but they learn by observation. So they observe our behavior, and they observe our reaction to this behavior. So when something happens and we act normal, they figure out that it's okay. If something happens and we act agitated, they figure out it's time to bark. This and mailman for some reason. So if we, instead of teaching our machine of all the types of things which can go wrong, teach it what is right, like teach it to observe and learn our reaction. After some time, it's going to be able to predict our behavior. Like here, it can predict that my daughter can go left, can go forward, can go right, and most likely she's going to go out to the door. Not now, though, because she's on self-isolation. But if she falls, then it's something which has not been predicted. So the machine says it's an anomaly. That's a new type of behavior. And as an artificial dog, it would watch humans respond to that. So in our case, this would get a question sent to our monitoring team, where they would see a simple question like, is this normal? Should we notify the family? Do you see a person on the floor? And in this case, there's a senior trying to climb on a chair and swap a light bulb, which is a type of behavior which the senior has never demonstrated before. So our operator in the monitoring center is being asked this question, and they can either send it to the family as an alert, or if it's something critical, they can escalate and call 911 actually. And we have saved 6 people so far by calling 911. And this feels really well. And further improving this technology can allow us to do more things. We can actually recognize complex actions by simplifying them. So this allows somebody without any coding skills or any machine learning knowledge to train a machine to recognize a new type of action. And all I have to do here is just to mark this video from like second 3 to second 4 and say, here's what happens in this second. It's called a squat. So now machine find me all examples of squats and tell me how in my patient population, and tell me how often they do them, or some other action. And this allows them to understand trends. Also, we use this technology right now to compose summaries. So all of our clients receive 2 summaries per day, one in the morning, which would say, hey, mom slept okay through the night. She only woke up 3 times. One time she went in the bathroom, 2 times in the kitchen. And then in the evening, it would also have the day summary, when the caregiver arrived, what they did together. So this allows to track several important features like social isolation. Do they see other people? Do they talk to other people? How lonely they are? Do they eat normally? Do they sleep normally? Are they active enough? And other stuff. So this is live. We're selling this device from January, and it's $299 per month on a fixed subscription. We also sell to institutions and to businesses. And well, I guess I'm happy to answer any questions if you have any.
Thanks so much, Nick. Unfortunately, we're out of time, so can't dig into questions, but if there are any, we'll be sure to shoot them your way. Thanks so much. Next up, we have Lazarus. Ariel, you on?
Yes, I am. Sorry, Zoom froze for a second.
Welcome.
Here, let me share my screen. Can you all see us?
We see you.
All right, awesome. So, we just get started then. Physicians routinely have to turn information like this into information like this. Actionable outcomes that they can use to save patient lives. And normally this is, for those of you who've already seen this presentation, this is the part where I start talking about our great AI, the thing that's currently used by dermatologists to screen for skin cancer that seems to almost always outperform derms when tested 1-to-1. But not today. Right now, we're in the middle of a crisis. We're in the middle of a huge pandemic that I don't really have to describe to any of you because we've all felt the ramifications of it in one way or another. So I'm going to be talking about what we're actually doing right now to help with the current pandemic. So we have 3 specific responses to COVID at the current moment. LAZARUS Connect, LCDS COVID, and Catch. And I'm going to run through them all really, really quickly so we have time for questions. For LAZARUS Connect, most of you already know what this is. For those of you who don't, we have created a single source API that now allows anybody to pull a health record from any medical institution using a simple login via MyChart or any of the other associated logins for patient-side logins for different EMRs. Patient logs in, patient says, I agree to have my records transferred. We go in, we pull the records, we basically just push it to wherever you need them, and we do this for free. At the current moment, what we're also doing is we're offering free implementation support for all COVID-19 projects. So 8 projects have taken advantage of this. And you should start seeing this in most of the COVID tools on the market pretty soon. Why? Well, it turns out your health records are pretty important for determining whether or not COVID is going to affect you. Important enough where we've actually launched a new version of CDS, our clinical decision support tools. So instead of trying to tackle skin or cervical or ovarian or uterine or cancers in general, really, what it does is it uses past examples that physicians have undergone. So past patients, past treatment profiles, past whatever. And it uses that to actually recommend new treatment courses. So it learns in real time from physicians' actual actions within their EMRs. Right now, it only works with Epic because that's who we spoke to first. But we're planning on trying to roll this out to other EMRs and other health systems soon. 5 health systems are currently using this to do things like this. Identifying most effective treatment routes for COVID. So these are just 3 of them. Most of you have heard of hydroxychloroquine, Some of you may have heard of remdesivir. I'm pretty sure the majority of you have not heard of the first treatment. So hydroxychloroquine was until recently touted as basically a cure-all for COVID, which is incorrect. Turns out the results are super mixed on that front. Kind of the same thing on remdesivir, but in the case of plasma for recovered patients, turns out that, well, for about 50% of physicians, when asked this question, it was very effective. And that enabled physicians to more effectively treat their patients. And it also enables physicians to answer other questions like, what are patients' chances of survival if intubated? If a patient's chances of survival is 5% if intubated, you probably should intubate the person who has a 90% chance of survival in that context. It's a dark decision, but it's the kind of decision that emergency physicians have to make every single day nowadays, because I mean that's how you save lives. Also, on top of that, what are a patient's chances of being currently infected with COVID versus the flu? If someone comes in with sniffles, a sore throat, and a cough, which of the two is it? And also on top of that, what does a patient who's likely to become critical look like? Because we still kind of don't know. We know that if you're older, you have a higher chance of becoming critical. We know that if you have autoimmune disorders, you have a higher chance of becoming critical. But in Italy, physicians and clinical staff are becoming critical at higher rates than ordinary people. Why is that happening? So yeah, I mean, we built out these tools to actually help physicians solve some of these questions. And so far, I mean, it's been working pretty well. I can talk more about this in a bit if needed, but here's the actual most interesting part. So we've actually been working with a bunch of other startups, over 50 plus engineers now in total, actually, or engineers, clinicians, and data scientists in total, to build out this. So this is Catch. What Catch does is you answer a few very simple questions about yourself. Maybe link your MyChart or your EMR record, electronic medical record. Maybe you link your email. Then at the very end, you can also link a hospital system or a specific physician, and it gives you a quick response as to what you should probably do. This is following CDC and World Health Organization guidelines. Also on top of that, we got some input from some emergency physicians to actually do this. And what it gives to physicians is a 360-degree view of patients all across both your health system, yourself, and your region, primarily states at the current moment because it's deployed in the US. Over 5,000 people have been tested using this since it launched a week and a half ago, and it's growing exponentially. It's great. But yeah, the most important part about all of this is that every single one of the tools that I've mentioned so far are all free. We're not charging anyone for it, and we're not monetizing them. So if you want to get yourself screened for COVID, you can go to covidtool.org and answer those questions. And that's about it.
Awesome. Great stuff, Ario. Unfortunately, I hate to do it again, but we have to stay on time. So if you do have questions for Ario and Lazarus, please feel free to let us know. You can shoot any of us an email. I'm sure he'd be happy to connect one-on-one as well. Great. Are we ready for our next startup? Next up, we have Jordan with Neurotrack. Jordan, are you online?
I am, yes, thank you.
Welcome. Please share your screen and take it away.
All right, here we go.
Great.
All right, fantastic. Thank you so much for having us. We're excited to be here and chat about what Neurotrack is doing. I know we've talked with a number of different insurance companies at this point. We've been very involved in the plug-and-play ecosystem for quite a while. But it's really interesting what COVID really, similar to what Lazarus just talked about, presents some really interesting opportunities when we think about how we utilize our fully digital, fully remote platform to be able to help people and figure out how to understand and make the best of a difficult situation. So Neurotrack is a venture-backed company here in the Bay Area. We started in Japan, really focusing in the life insurance market, coming back to the US last year, working with top 10 insurance carrier. We are actually now working with a top 10 reinsurer as well. We really focus on early detection and subsequent risk reduction for cognitive decline. And so thinking about that in a couple of different models, whether that be in the long-term care space, where people get access to our technology to stay healthy over time, to maximize health outcomes, whether it be on the underwriting side, which is what we're doing primarily with our reinsurer to build out that product on the underwriting for life. And then we think about similar when we think about that continuous underwriting as well for people to stay healthier and stay involved. And then one of the big things that we've done that I'll talk a little bit more about is on the adjudication side with one of our partners when we think about classic cognitive testing, needing to send someone to somebody's house, now the ability for us to do that in a completely remote fashion. And the way we do that is through eye tracking. Neurotrack leverages consumer-grade technology. So the front-facing camera that's built into smart devices, your tablet, your laptop, et cetera. We track eye movements, and based on an individual's visual response to a series of stimuli on a screen, we can actually predict somebody's long-term risk for developing cognitive decline. And I won't go too deep into the science. We're happy to share all of that with the people on the call. But we know that we can predict conversion from either healthy to mild cognitive impairment or mild cognitive impairment to Alzheimer's with 89% accuracy within 3 years and 100% accuracy within 6 years. Neurotrack really exists to solve two primary problems in the space. One being that cognitive assessment is lacking. In fact, 82% of seniors say it's important to get their cognition checked, but only 16% actually go through the process to get that done. This is because clinicians are hard to get a hold of that have that level of specialization, but the testing process is also incredibly subjective. 10 different clinicians could do the same battery of tests and 10 different responses and 10 slightly different outcomes. Even to go through all that process, you still end up with treatment options that are almost none. There's no pharmacological drug that's been approved for the treatment of cognitive decline. And even the few that have been approved in the space are only for symptoms, not for treatment of the disease itself. And so that's really what Neurotrack focuses on now. We are an end-to-end cognitive health solution that focuses on baseline assessment that people can do anywhere, anytime from the access of smart technology in their device. We help them monitor their cognition long-term, see if they're staying healthy, are they at their baseline, are they improving, or are they starting to decline? And for those that need it or those that are interested, we can actually move them into what we call our cognitive health program, where they can engage and get a personalized solution that focuses on things like exercise, diet, sleep, stress, social engagement, cognitive interaction. Those modifiable risk factors that we know from the literature are proven to help move the needle on cognition and improve long-term cognitive health outcomes. So when we think about cognitive assessment, and this is really where when we think about things like underwriting, adjudication, things like that, because we're utilizing the camera to do eye tracking, this allows us to do fully asynchronous remote testing with users. And it gives us that quote unquote eyes on the patient, removing the need for one-on-one testing and supervision. This is because we can QA the data that comes in. We can QA the environment in which they're taking the test to make sure that they are not in the back of an Uber, at a concert, in a crowded room. We've seen all these things. Also, we can make sure that they're paying attention to the test. And so if we give them a low score, it's because they deserve that score and not because they were petting the dog, eating food, watching TV, etc. So this allows us to really scale this concept of cognitive testing, reach people in their homes without having to do this one-on-one connection. The trials of trying to schedule time, send people in, it's very arduous. And we're not reinventing the wheel. We're using very established test constructs, things like executive function, processing speed, simply digitizing them, enhancing them with eye tracking to get that fully remote experience. And for people, once we understand their risk and we want to help them move forward and take hold of their cognition, we enroll them into our cognitive health program. The cognitive health program is based on the landmark finger protocol that was done out of the Karolinska Institute in Finland that showed that a comprehensive lifestyle program, things like I talked about earlier, exercise, diet, etc., can all help, when personalized properly, move the needle on cognition. And you see in that original study, we saw improvements in overall cognition, executive function, and processing speed. Our own data show the same. We published a study late last year looking at initial results from a phase 1 study we ran, finding increases in cognition, as well as subsequent decreases in depression and anxiety, both of which are direct risk factors for developing cognitive decline. And so when we think about partnering with Neurotrack, some of the classic ways that we've done this have been kind of in that aging in place model, where we're looking at long-term health outcomes, people engaging on the platform over time. Similar work that we did with Daiichi Life, Sample Holdings, our primary partner here in the US in the long-term care space, having people on the platform long-term to monitor, enroll in the program, and take control of their health. Similarly, if we think about the space of accelerated underwriting, this model makes a lot of sense, where we're trying to keep people engaged, have them involved over time, be able to have them track their health, improve outcomes. Ultimately, being able to tie that to premiums is a very powerful model for people to, again, increase engagement in that kind of a program. Especially when we think about long-term care and the fact that 60% of claims in the long-term care space are actually related to cognitive health. that becomes a very big number very quickly. The other piece is on the cognitive assessment side. We think about standard underwriting, being able to remove the need to send somebody into somebody's house. We can do that fully remote. We can QA the data, give a fully objective result instead of having these classes, whether it's the MOCA, the MMSC, the MCAS, where you're making a lot of subjective decisions and it's going to be dependent on the person administering that task, as well as the adjudication side. And this is something we're doing right now, where we are actually going live with a pilot in just a few weeks to look at adjudication, where we will be able to do this fully remote assessment for individuals that are going on claim to help provide objective results back to our providers. And so I'll pause there. You can contact me for more info. I throw my email on the screen there, and I'll happy to answer any questions that anyone has.
Awesome. Thanks so much, Jordan. Just as a quick update, we're going to forego questions just to give everybody equal time and a fair shot. But reminder to everybody else, if you do submit questions, please leave your name with your question so we can be sure that Jordan and the others get them directly and we can connect everybody one-on-one. So thanks so much, Jordan. We will be sure to shoot over questions your way, but feel free to reach out to him directly if you'd like as well.
Thanks, Rachel. Thank you, everyone else. We appreciate your time.
Great, so we're gonna jump right in to our next startup. It's Life and Health Metrics. There we go, awesome.
Okay.
Take it away, thanks.
Thank you. So hello, everybody. My name is Evgeny Yakushev, Jr. I am the business development representative of Life and Health Metrics, and I'll quickly run you through what we do. So basically, Life and Health Metrics is the disruptive solution for dynamic underwriting based on locomotion tracking, and I'll explain in a second what that means. There you go. So the executive summary, quickly in 5 bullet points. We are a spin-off company from biotech startup Gero.ai. Our parent company has actually hit the news recently with a big news on their drug development research for COVID-19. I think they ran some tests and found 6 possible cures from coronavirus. So basically what we are is the disruptive solution based on correlation between physical movement patterns and biological age, and I'll explain that in a moment again. What we provide is practically a health score and agent indicator. It can be instant or dynamic, so we have an opportunity for multiple industries here. The way it works for the end customer is basically the personalized insurance platform. So it allows users for healthy lifestyle promotion, positive behavioral impact, multiple solutions in that sense. And when we're talking about insurance companies, it's really about the dynamic risk underwriting, which gives our clients the insights on aging and longevity risk predictions for pricing and reserving. So we can talk a lot about the problem, but it really boils down to the fact that there is a digital transformation going around the world. People are using their smartphones more than ever. They want everything to be going to their smartphone. Whereas pension and insurance industry are really lagging behind. We don't really see that many solutions that are digitized. However, the 4 most important points here are the fact that the current statistics is based on the past mortality experience. However, the next generation will actually live by the new trends, such as healthier, longer, more active, and the past mortality experience and past mortality and morbidity tables are actually not accounting for that. So as a result, we have a lack of personalized data sources, which ultimately leads us to the fact that current life insurance companies are unable to adjust for emerging longevity risks. I'm not going to stop on the market overview. It's really, we've done our homework, we know the market. The point is, the core of technology is really the fact that the smartphone is the ultimate source of information right now, and the new sources of data mean new products. So what we do is, like I said, we provide online scoring based on on the data that is stored on your smartphone, literally your steps. So we are able to generate, a new generation of insurance products. And the way our technology works is really by the win-win concept, which means that the more data we accumulate through our platform, the more value we can provide for business, as meaning the insurance company and the end user. So how it works, basically the human, through our app or API or SDK or whatever, the human locomotion activity is recorded in steps per minute for 2 weeks interval. The statistics is transitions is between states of different activities. So you can, sit on the couch, you can get up, you can walk around, you can, it will record that. It forms the statistical description of the time series and represents the data by transition metrics. Then our AI is stepping in, and our trained neural network determines the age corresponding to movement patterns and deviations from chronological age. So basically, we figure out how what's your biological age in comparison to your actual age. We validated our data using UK Biobank data, which was more than 700,000 real users, so real data points. Our current traction is we have 2 paid pilots in Russia. We have 2 patents pending. Our technology has been validated by independent researchers through Munich Re or SCORE and some other companies. We have 5 scientific peer-reviewed papers published. We have 700,000 people data analyzed by UK Biobank. And we also have more than 70,000 downloads of our iOS MVP. The biggest takeaway from this slide is really the fact that through our research, we determined that there is a nonlinear correlation between the number of steps and risk health metrics. So, the more you walk does not necessarily determine that you're staying healthier. It's really about the fact how you walk and how active you are. We have a very experienced team. My father is the CEO. He has 25 plus years in executive roles in pension and insurance companies. We've got an amazing CTO who's been in insurance industry for more than 20 years. And we also have a great CSO, which is a data scientist from Jero. And I myself is the BD representative in San Francisco. And our roadmap is as such, we basically are currently in our seed stage. We're raising a seed round of about $1 million and looking to acquire new clients. This is our point of contact. Please reach out if you have any questions. I hope I'm not too much over time.
Great, thank you so much. Last but not least, we have our final startup of the day. I think Limor is online. We have ContinUse Biometrics.
Okay, so thank you guys for staying this long. I'm going to try to keep it short. So I'm the VP and General Manager for ContinUse Biometrics, and in short, Cubics. And we do many things. I'm going to focus today on remote patient monitoring using our technology of contact-free sensing, which is used by healthcare insurers, payers, providers, and of course, many other industries. So our mission is really to enable better health, better safety, and care practices through a contact-free, very simple, and precise monitoring solutions. We see a growing challenge in the healthcare system with an increasing aging population. I think many people said that before me today. Life expectancy growing to 85 by 2030. And of course, challenges related to healthcare personnel being stretched, readmission rates going up. So this is a problem that's expensive on many levels, of course. We see a move from traditional centralized healthcare practices, which are providing insufficient, to more decentralized remote care. Technology advancements enable more connected devices that offer such medical data. Many of you probably heard companies like Microsoft are creating interoperability and healthcare data protocols. And of course, viruses like COVID-19 might be responsible for the single greatest leap in driving remote patient monitoring to becoming mainstream. So this is the talk of the day. So basically, not only the need has increased, but now the demand is here. The market is much more receptive to telehealth and remote monitoring. But with all of that, growing senior population requires technologies that really match their needs and capabilities. And of course, bringing these technologies to industries like the automotive, like insurance, require adapting them to be much, much, much simpler. So Cubic's contact-free monitoring really turned science fiction to reality. And if things look very simple for you here, we've achieved our goal. The technology enables monitoring of vital signs on a medical grade without touch. And that includes heart rate and rhythm, respiration rate and rhythm, heart rate variability, cardiac acoustics. Think of a digital wireless stethoscope, and even continuous blood pressure measurement, which just doesn't exist today, even in a touch device. Think of having a cuff on your arm all day long. So the solution is completely contact-free and was validated in many clinical trials, providing medical grade accuracy. We completed clinical and usability trials with the FDA, about to go into submission, and expect to have FDA approval by the end of this year. The solution combines patented optics and algorithm. If you ask yourself how it's working, essentially by pointing light at the object, we measure nanovibration of the body. We detect and record multiple physiological parameters within medical grade accuracy. As we know, most telehealth calls are related to managing peripherals and not actual medical issues. This solution doesn't require any medical know-how or handling of any, aspects of IT or sysadmin issues like connectivity. Also very important is the solution is agnostic to light conditions. We can measure a person sleeping in bed at night in complete darkness. It's agnostic to clothing, it's agnostic to skin color, and even certain level of motion. We can measure a person in a car that's moving in even harsh road conditions, stationary bike, a treadmill, and more. A couple of last things. So our data is streamed to a HIPAA and GDPR compliant health cloud where machine learning models and AI techniques identify trends and alerts and anomalies and providing insights that enable better health, safety, and well-being. It's being integrated, the solution is being integrated. We have a standalone device, but we also have the option to integrate into existing devices. And as we speak now, the solution is being integrated into some of the top laptops, tablets, phones, cars, and medical devices. A few, usage examples. Usage ranges from preventative care at the workplace, home, or car to monitoring chronic patients and elderly people in medical facilities, as well as assisted living or aging in place, and of course, securing the competency of a driver and well-being of passengers. Just one last word about COVID-19. It's kind of inevitable. Of course, we enable the protection of medical staff in monitoring COVID-19 patients because we enable remote, contact-free vitals taking. Feel free to ask me for more information, but basically we're working with hospitals and governments to bring this to border control, medical facilities, and more. Even a workplace check-in at critical workplaces. That's it from me. If anybody has any questions, please feel free to write to me.
Great, thank you so much, Limor, and thank you to our 5 presenters today. Some really great stuff. Again, feel free to reach out to them directly. If you weren't able to grab their contact info, we will be distributing this after the session, but you can also reach out to myself and Hutch to connect one-on-one for any questions. But to close us out, I want to bring Hutch back on for some final words.
Thank you so much, Rachel, and everybody who joined us today. Another special thank you to everybody who participated on the panels and the presentations. As you guys kind of got a bit of a quick taste today, we are going to do this in a more regular format. You can see up here on the screen some of the upcoming topic areas that we'll be covering. We are very excited to see you guys every week. And feel free to share this internally with your organizations. This will be an opportunity to kind of educate and expose some of the other business units within your organization on some of the trends that we're seeing. Additionally, we'd love to hear from you guys. So send us notes, feedback, let us know what we can do better. We'll be changing this format a little bit and dialing in on the structure of this. But again, this is for you guys. We want to make sure that we're hitting on topics and making sure that we're bringing real value to you. And then lastly, special thank you to the team. Rachel, Fan Lee behind the scenes over here. There's quite a few others. They work hard and there's lots of communication going on behind the scenes. So a special thank you to everybody who's keeping the lights on over at Plug and Play. So with that, quick thank you to everybody. Make sure you stay inside, stay healthy. And if anybody has questions or follow-ups, reach out to the team. Talk to you soon.